Anemia. Anemia describes the condition in which the number of red blood cells or hemoglobin in the blood is low. For this reason, doctors sometimes describe someone with anemia as having a low blood count. A person who has anemia is called anemic. The normal level of hemoglobin is generally different in males and females. For men, a normal hemoglobin level is typically defined as a level of more than 13.5 gram per 100 ml, and in women as hemoglobin of more than 12 gram per 100 ml. How does the body make blood? Blood is comprised of two parts, a liquid called the plasma and a cellular part. The cellular part contains several different cell types. One of the most important and the most numerous cell types are red blood cells. The other cell types are the white blood cells. The purpose of the red blood cell is to deliver oxygen from the lungs to other parts of the body. Red blood cells. Red blood cells are produced through a series of complex and specific steps. They are made in the bone marrow, inner part of the femur and pelvic bones that make most of the cells in the blood is bone marrow. And when all the proper steps in their maturation are complete, they are released into the bloodstream. The hemoglobin molecule is the functional unit of the red blood cells and is a complex protein structure that is inside the red blood cells. Contrary the most cells in the human body, red blood cells do not have a nucleus metabolic center of a cell. Nucleus. Red blood cells live about 100 days, so the body is constantly trying to replace them. In adults, red blood cell production occurs in the bone marrow. Doctors try to determine if a low red blood cell count is caused by increased blood loss of red blood cells or from decreased production of them in the bone marrow. Knowing whether the number of white blood cells and or platelets has changed also helps determine the cause of anemia. Thanks for watching.